Hi, and welcome to Mission Nonprofit. I'm Dick Poost, your guest host for this episode. Mission Nonprofit features a local nonprofit organization from the Thurston County area. And this month, we're going to be talking about behavioral health resources, or BHR as it's usually known. My guest is the CEO of BHR, John Masterson. John, welcome to the show.
Dick, thanks very much. It's great to be here with you.
Well, let's tell everybody what BHR is. What is Behavioral Health Resources?
So BHR is a nonprofit that was begun in 1956 at the leadership of Dr. Philip Vandeman, the first board chair. Our purpose is to provide community mental health services and addiction recovery services to people in Thurston, Mason, and Grays Harbor counties.
Now, you mentioned Dr. Philip Vandeman, one of the founders. Everybody lists his name. Believe it or not, he was my doctor when I was a kid.
Actually, I find it very believable, and I feel pretty blessed to have met him and known him for a couple of years after I started at BHR before he passed away. What a delightful man.
Well, I keep a diary, and I was going through my diary not too long ago, and I found out that my sister became ill, and he made a house call. I did not know he made house calls.
Well, and that, was a thing of the past for a while, but you actually do now see physicians making house calls again in some circumstances.
So BHR started out as in the old Memorial Clinic downtown. Some people right now watching this will remember the old Memorial Clinic. It was right across from Bayview Thriftway.
Right.
It's an old abandoned building right now, kind of with graffiti all over it. That's where Dr. Vandeman's office was. Now, it grew from there. Why do you think he went this direction?
Well, as I understand the history, the community rallied around an event that involved a youth and a murder. And I don't know the complete story, but they became concerned about what was going on in the community, and they formed the Thurston Child Guidance Association, which worked on the issue and subsequently formed the Thurston Child Guidance Clinic. And that was incorporated first in 1956. It years later became the Thurston Community Mental Health Center, and then about 15 years ago became Behavioral Health Resources. And that most recent name change was associated with the addition of addiction treatment services. Now,
Dr. Vandeman, his main concern was children, pediatrics. BHR is more than children now.
Yeah, today about 60% of the people we serve are adults and about 40% are children. So although we started with just children, they're still a major part of what we do each day.
Now you serve, as I recall, something like 10,000 people a year, individuals.
Over the course of a year, we touch about 10,000 individuals, and some of them are enrolled in ongoing services because they have severe and persistent mental illness or severe emotional disturbances. We provide services to people who are in acute states. They may have a brief episode of illness that we see them in our inpatient facility or for brief outpatient services or for crisis services. But over the course of the year, we touch about 10,000 people.
And I think I read somewhere where if you counted the number of visits, it'd be something like 100,000 different, as I think you call them, billable incidents a year. 100,000.
That's correct. If you stop and think that 1 in 5 individuals in society today suffer from some form of diagnosable mental illness, and you think about people needing ongoing treatment, it's an easy stretch to get to 100,000 episodes of service.
Now, where is your campus? Where physically is BHR?
So BHR is actually spread across 3 counties, Thurston, Mason, Grays Harbor, but a few years ago we were fortunate enough to move into a 3-building campus on Martin Way. And if you know where the Chehalis Western Trail crosses Martin Way?
I do.
Our driveway is right there, just west of that trail on the south side of Martin Way. And so we've been in that location since 2000, I want to say 5. I can't remember the exact date now that I think about it. And then most recently, we were able to acquire 2 additional adjacent buildings, so we're in the process of expanding that campus.
I have a feeling that if there was no BHR, downtown would have a lot more of a homeless problem. Their jails would be much more packed than they are now, and the emergency rooms would be overwhelming with, overfilled with people.
And that's true. You touched on the 3 areas that feel significant impact because people are living with untreated mental illness and addiction. So they do live on the streets, they do impact our emergency departments, they do impact the criminal justice system. One of the sad parts about this process is that people who are untreated often are committing crimes of survival, and they end up incarcerated for petty theft or trespassing or things of that nature. It's not the majority of the people who suffer with mental illness, but that subset ends up in the jails, and it's an expensive place to house them. It's also not very good in terms of treatment. That's not their purpose in life.
So if you go downtown Olympia, very often you will run into somebody that obviously has a mental problem. I mean, it seems obvious even to lay people like myself. How does a person get from there into your care?
So there's easy ways to do that. They can call BHR's main number, 704-7170, and we'll direct them to the appropriate facility. Or they can literally walk into our access center, and that access center is on Mary Elder Road at our evaluation and treatment facility. And that's 3438, I believe, Mary Elder Road. It's right behind Bayview Lumber on Martin Way. It's only just east or just west of Lilly Road.
I'm glad you brought that out because I was thinking, as long as I've lived in Olympia, where is Mary Elder Road?
Yeah. It's this very small street, but it's a beautiful setting. It's up against the wetlands, and so, but you can walk into that facility, and our goal is to see you within 30 minutes.
30 minutes?
Within 30 minutes. Now that we operate that center from 9 in the morning till about 5 at night, and so if you show up late in the evening, we may give you an appointment for first thing tomorrow morning, but you can walk in and be seen without any significant delay.
Do people actually do this?
We probably enroll about 150 people each month who do that.
Just walk-ins?
Just walk-ins.
That's incredible. Now, how do they even know you're there? I mean, if I was wandering the streets of downtown Olympia and had a problem, I'm not sure I'd be thinking of you.
Well, but people who work with downtown homeless individuals, whether it's youth and it's community youth services, or it's the Salvation Army, or it's the Family Support Center, they know about us and they know where we are and they know how to make those referrals. But we also get referrals from schools, we get referrals from doctors and from hospitals.
So are most of the patients, do you call them patients?
We tend to call them clients when they're on the outpatient services, and we call them patients when they're admitted into inpatient services.
Do most of your clients come to you because of a referral?
Vast majority of them do, yes.
Not too many people just pick it up on the street and somebody says, hey, go to Mary Elder Road, somebody will help you.
Yeah, not a lot, but that does happen.
Do people really want to be helped?
Vast majority of them do. I mean, there are a subset of folks who choose not to be treated, and you have to realize mental illness, like any other disease, treatment is voluntary. We don't force people to take insulin for the diabetes. We don't force people to take chemotherapy for cancer treatment, and we don't force people into mental health treatment, with a very narrow exception, and that is if they're a danger to themselves or others or gravely disabled. Those are the words right out of the state statute.
Do you ever treat somebody who's actually incarcerated? You go to them?
We do have staff who work in the Thurston County Jail and the Olympia City Jail and the Mason County Jail and even into Grays Harbor County jails. Yes.
What is a typical type of person that you might deal with? Give me an example. I'm sure there's a huge variety, but just an example of somebody you might be helping.
Well, let's take someone who's suffering with just an awful disease called schizophrenia. And so we will treat them frequently with appropriate medications known as antipsychotics. We will treat them with therapies. And we also provide them what we refer to as community support. Because they're often, these are known as thought disorders, they're often unable to think as clearly as you and I. They may need help finding appropriate housing. They may need help with transportation. They may need help even living things, doing things like cooking and doing their laundry. So we help them learn those skills because they may not have them.
I've heard that schizophrenics and maybe others sometimes don't want to take their medication.
That's true. Have you ever taken antibiotics and stopped before they were
Yeah,
all 10
because it
days.
makes me a little sick at my stomach to take them. I don't like taking antibiotics.
Right. I mean, it's a problem across all of medicine, but we do have individuals who suffer with mental illnesses who choose to not take their prescribed medications, and often it's because the side effects are unpleasant. And we have the unique situation where somebody might, say, be having hallucinations, and the medication takes care of those. They now think hallucinations are gone, I no longer need the medication. But in fact, once they stop, the hallucinations return.
Or maybe the hallucinations were fun, and maybe they missed the old life.
Well, and in the case of someone who suffers with what is known as bipolar disease, they fluctuate between periods of depression and periods of mania. Oftentimes people who suffer with bipolar say, I like the manic phase because I feel good, I've got lots of energy, and I accomplish amazing things. And so they may choose to not take medication just because they're doing so well.
Yeah, they don't want to be on a level plane. They want to be up here somewhere.
Right.
So do you have success stories, or is this simply a management of a situation? Do people ever outgrow the need for you?
They do. And I want to make it clear, there are, quote, no cures for the illnesses that we address, but there are effective treatments, and we do have success stories. It's not, well, I'll give you an example. There's a gentleman in town who recently brought me a couple of gifts because he was graduating. He was leaving our services, he was doing so well, and he was just tickled to death. So he brought me a bamboo plant that sits on the table in my office today as a reminder of people can successfully live with this chronic disease, much like people live with diabetes.
And that makes you feel really good because it worked.
Yeah. Yeah.
And that all this effort that BHR does continuously is making a big difference in our community.
Right. We do a lot of work in schools with young children, and to see kids who are struggling, whether it's things like ADHD, which is so commonly discussed today, or other emotional disturbances, to see them be successful and stay in school and graduate and go on to college and have successful lives, because we'll see them for years.
Let's talk about these children for a moment. Let's say you're a parent and you have a child in school who is a problem. The kid can't seem to get along with teachers or fellow students, and the parent doesn't have the money to get a psychologist, and the school doesn't really have one either. What do you recommend for that parent? How do they get help for their child? The parent just has no idea as to how to handle the situation. What do you recommend?
Well, I think the first thing they can do is call, and we can direct them to an appropriate service. If most of the work that we do is funded for people with a Medicaid coupon, and if we have children who are financially eligible to be paid out of the Medicaid system, we'll go through an assessment process, and that's what happens at Marielda Road. And then our clinicians will assess them and either provide treatment directly for them or make appropriate referrals for them.
Now, you talked about the money aspect. Mm-hmm. You're a nonprofit organization.
We are.
Now, everybody knows that, well, nobody's rolling in money these days, but
Correct.
Especially nonprofits. Where do you get your money?
So, as a nonprofit provider of healthcare services, we bill the local Thurston Mason Regional Support Network for the services that we provide. So, and in the mental health system, the publicly funded services are administered by the Thurston Mason Regional Support Network. So we contract with them to provide these services. So children with the Medicaid coupon who need services get services with no direct cost to the children or their parents.
Now, you are a bunch of professionals. I could have said that in a classier way, I guess. But the folks at BHR are professional people who have jobs. You have something like 300 employees.
Correct.
And they're all being paid family wage salaries.
They are.
BHR is a huge economic impact in our community.
We do. We've gotten in excess of 300 employees, and they include psychiatrists and therapists and case managers and nurses and a host of administrative people, whether they be information technology or medical records or office support. There's a broad spectrum of people that it takes all those skill sets and their effort to make this work. And they do a marvelous job. I mean, all of the service we provide are provided by people. We don't use machines, and so we have highly educated, highly skilled, and highly professional individuals that love working with people who are in recovery from mental illness and addictions.
So when people get help through BHR, they're being helped by the best.
Absolutely.
Top quality folks.
Absolutely.
Who are earning, shall we say, family wage
They do. Our
salaries.
Annual, about 80% of BHR's expenses is in salary and benefits.
Now you've had to make some cutbacks in this terrible economic time that we're in.
We have. We grew substantially in the early part of between 2002 and about 2008. And we peaked in 2008 with a little over 400 employees.
Whoa.
And since that time, because of reductions in funding and other changes in contracts going on, we shrunk about 27%.
So what did you have to cut?
Well, in some cases it was entire programs, in other cases it was shrinking programs. An example of an entire program that was reduced was called the Triage Center, and this was one of the early cuts when the state budget shrank. It was a program that, similar to the Access Center, was open for walk-ins, but it was designed to take crises, and it was operated 24 hours a day. And so police and ambulances could bring individuals who were suffering acute episodes directly there. Today, most of the time, they go to the emergency departments at hospitals.
So you have had to make cutbacks, and that's been hard, I'm sure, laying off 100 people or...
Yeah, the good news is only about 35 of them were actual layoffs. The others were attrition through normal turnover. So
have things turned around?
They have. We had a couple of very lean years, but through the hard work of the remaining 300 plus individuals, we've been able to get back on some stable financial footing. We think we've resized ourselves so that we're appropriate where we need to be, and because the demand hasn't shrunk. Even though we've experienced funding reductions, the people who suffer with mental illness haven't gone away. They're still present.
Could it be possible that the demand has actually increased?
It has, and there are some folks who don't have the appropriate Medicaid coupon that we've not been able to serve. There are folks who don't have the appropriate coupon that we are serving under our uncompensated care policies, so the charity care that we provide for folks.
Now, even though the economy hasn't turned around, there is one little piece of expansion that BHR is trying to undertake right now, and it's not a giant one, but it's an important one. You want to tell us what that is?
Well, it feels pretty giant to me. One of the things that has become clear in recent years is that persons who suffer with a severe and persistent mental illness also suffer with what we refer to as comorbid medical conditions. What I mean by that is they suffer with other serious medical issues. Could be diabetes, could be hypertension, could be cardiac disease. And because of that mental illness, they often don't have the access they need to good primary care, to a family physician or a family nurse practitioner. And so their other medical diseases go untreated. And there's data from around the country that has substantiated this over and over again. So I mentioned earlier that our campus has expanded by a couple of buildings. Our goal for one of those buildings is to co-locate our psychiatry services along with a family practice for people to get their primary medical care. And so we're in the process of trying to plan out the addition of the family practice, the primary care clinic, and we've launched a capital campaign to raise the money to improve the facility to be able to provide these services. We acquired the facility because of the generosity of people 5, 6 years ago in a capital campaign. And today we need to finish out the build-out inside those buildings.
The amount you're trying to raise, 900,000?
Actually, 800,000 in the capital campaign.
800,000.
$800,000.
That is really, shall we say, modest in today's fundraising world. How you doing on the campaign?
We're about 25% of the way there. We just publicly announced the campaign a few weeks ago, and so we're doing some quiet things behind the scene right now. We'll be back into a much more assertive process later in the fall of this year. And our hope is by the end of the calendar year we've been able to raise enough pledges to meet our goal and start the tenant improvements in those buildings.
So if you are successful, and I know you will be, and you consolidate everything in this one campus area, that means that if somebody comes in, they may be off the street and they have a mental situation, say bipolar or whatever, but they also have diabetes or some physical condition, they will be treated in a more efficient way. How will that work? They walk in and they're getting the help for their mental situation, but how about the physical? How will that work?
Well, it could be as simple as somebody's in seeing a psychiatrist for their mental illness, and they don't have a family doc, and the psychiatrist notices that they may have some physical condition that needs to be addressed. It could literally be a warm handoff where they walk them down the hall and say, look, we need to have somebody take a look at this, and let me go with you, and we'll take you down the hall to have that happen. Unfortunately, most of the individuals that we serve tend to be reclusive. You know, when we talk about persons with mental illness, we all think of the people downtown, but those are the exception. Most of the people that we serve would just as soon not go outside and tend to hide away, and so the thought of another visit to a strange office someplace is a barrier for them. So by having them able to just walk down the hall with one of our staff will improve their access into primary care.
So with just a relatively small change, minor change at BHR, it would seem to me that you'd be making a tremendous difference in people's lives. Like you say, maybe they don't want to go down the street to find a doctor because they're sick. It was bad enough just coming to you.
Exactly.
And you're going to take them, give them the full package.
Yeah, and if you stop and think about the impact we can have on an individual's life, the national data suggests that persons with a serious mental illness tend to die 20 to 25 years younger than the general population. And that's unnecessary to a great extent because they're not getting treatment for those medical conditions. So if we can get them appropriate treatment for those medical conditions, they can live longer, fruitful, happier lives.
Well, John Masterson, CEO of BHR, you're doing a tremendous job, you and your people, for our community, and I want to thank you personally. And when you came into the TV studio here at TCTV, did you have anything you hoped that I would ask you, or that you wanted to say?
You know, I appreciate the thanks you just gave me, but I want to be clear that it's the staff that work there, the clinicians, the therapists, the case managers, the doctors, the nurses who do the hands-on care for people. They're the folks that make this work.
Now, if somebody watching this program right now wants to help or get help, who do they contact? How do they find you? Are you in the phone book or
We are in the phone
internet?
book. We are on the internet, and it's easy to find us. We're at www.bhr.org.
Well, thank you very much. Well, unfortunately, that's all the time we have for this episode. Thanks so much for joining us on the show today. I'm Dick Poost for Mission Nonprofit. Thanks so much for watching.
If you know of a local nonprofit that's making a difference in our community, give us a call at 956-3100 extension 103 or send an email to rkam@tctv.net.